Alumni President. And it's so great to have an amazing panel this evening to talk about something that I think all of us are passionate about. And I know I'm a grateful recipient of. So I'm going to go ahead and let the panelists introduce themselves and their background, and we'll start with Michelle.
Good evening, everyone. My name is Michelle Raslavage, and I am a graduate of Vanderbilt University Master's Program and the DNP program. And I'm also an instructor at the university. And I'm currently a full-time employee with the Center for Disease Control. But before this life, I spent over 23 years with the Indian Health Service. So I'll be talking today about the Indian Health Service Scholarship.
Christie.
Hi, good afternoon, everyone. I am Christie Smith. I'm the Director of Student Financial Services here at the Vanderbilt School of Nursing. So I'm here if you have any questions related to the Nurse Faculty Loan Program. And I've been in financial aid for many years, so that's my specialty. So if you have questions, that's what I'm here for.
Thank you. And Anand?
Hi, I'm Anand, and I just graduated this past, well, I guess almost a year ago from the pre-specialty and then psych NP program. Currently working at a children's hospital near Cleveland called Akron Children's Hospital. And I was part of the Nurse Corps Scholarship Program, which I applied for kind of the summer before I started at Vanderbilt. And now I'm kind of in service for repaying that loan. So they paid for things up front.
Awesome. And Elizabeth.
Hi, everyone. I'm Elizabeth Blanchard-Hills. I graduated from the PMHNP program in 2018. Received my scholarship while working at an FQHC in downtown Kansas City, Missouri called Samuel U. Rogers Health Center. I currently am in my own private practice and am enjoying it very much and was very grateful for the scholarship that I received. And I'm excited to share what little bit I might know about the process with you all this evening. Thanks for inviting me.
Awesome. And I will also share, I'm a family nurse practitioner, and I was a recipient of Nurse Corps after graduating. So hopefully, I think we've got a good representation of folks from different groups, which will be amazing to understand all the options. So the first question that I would like to kind of pose is, why did you decide to pursue a loan repayment program? And anybody can jump in anytime.
Because it was a $50,000 check deposited directly to my account. And because I was, at the time, was working for an FQHC, which after talking to the HR director, that was part of the reason that I decided to accept a position with that particular facility. I had been offered 2 other positions, but the opportunity to have the loan repaid was a significant factor in my decision-making process.
Awesome.
I can go next. I had kind of become familiar with, federally qualified health centers and different things like that while I was pre-Vanderbilt before I was a nursing student even. And so I realized how much I wanted to do that work anyway and work in those kinds of community psychiatry, primary care type locations. And also I kept going to school. So the amount of debt I was collecting really motivated me to just really apply to different programs to see if I could get a scholarship, and kind of was confident that, I knew I was going into psych. I knew it's one of those fields that's extremely in demand through HRSA, which manages it, the federal government. And so I just applied for it, and then it worked out.
Awesome. And Michelle?
Yeah, and this is Michelle, and I decided to pursue the program for Indian Health Service. Now, the difference is the Indian Health Service is a scholarship, so you get the tuition reimbursement as you're going through the program, and it's done up front rather than on the back end. So for me, and paying for my nursing school education, that was a huge relief and weight off my shoulders. knowing that my tuition for the semester was going to be taken care of up front. And I decided to pursue that one because, one, I am Native American. I'm from the Ponca federally recognized tribe in Oklahoma, and I'm also an enrolled member with the Oto tribe in Oklahoma. And as we go down through tonight's discussion, I'll get into more details about that. But then my cousin, she's half Navajo, and she's the one that told me about the scholarship, because she used it to go through a dental school with it. So she's the one that put the little bird in my ear and told me about it. And so I applied for it. So she told me she was already a year or two ahead of me on the scholarship program. So she was able to give me the landscape scenery as I was applying.
That's awesome. And Christie, from your perspective, I suspect you get a lot of these questions early on and throughout folks' kind of journey at Vanderbilt. Do you have any advisement from your expertise for people who are looking at pursuing the different loan repayment options or scholarships?
Yes, I do get asked quite a bit about those scholarships. Some of the best advice I can give, especially with regards to the Nurse Corps Scholarship and the National Health Service Corps Scholarship, you want to start looking into that and applying early. And I will be honest with you, there can be some confusing information that comes, because with our program, you can enter as a pre-specialty student, and in some of their correspondence with Nurse Corps, it may say that a pre-specialty student is not eligible. It can be somewhat confusing, but the best advice I've always been given when I have called Nurse Corps myself is to just have the students apply. So it is quite a bit of involvement with the application, and I'm sure Anand can speak on that part, but it's definitely worth trying to go ahead and apply for those scholarships, because they're good amounts, and it's anything to help with reducing the amount that you would need to borrow in loans, I would encourage.
Awesome, because these are very helpful perspectives. I think kind of putting myself back in the shoes of graduating and kind of getting my first reality check of what was coming my way from my student loans, I think there was so much confusion. So I love hearing kind of that looking ahead, preemptively considering options, that kind of thing. I would love to hear a little bit more about how people learned about the program they ended up choosing. So that's been kind of hit on, but if anybody else wants to add to that, how you learned and maybe how you chose to apply to particular ones could be helpful.
I can go. Was someone else just talking to? Okay. So before I started at Vanderbilt, I started looking into different programs, the scholarships in general. And there were two that I was kind of in between: the National Health Service Corps and the Nurse Corps Scholarship. So those are the two ones that, I thought would pay the most or would have the most scholarship amount available with them. And also, just to let you know, I think the way the process works, from my understanding, is you can apply to both of them, but they kind of do it in rounds where they invite you to tell them if you're for sure considering this, and once you tell them, you are not qualified for the other one anymore. So the way that mine worked out was that Nurse Corps contacted me first and said, you have 3 days to decide if you want to do this, to go credit score on you, and they don't officially confirm that you got it. But so I just knew about those two programs. They're both kind of similar, but different different service requirements. And honestly, just Googling as many scholarship websites will get you some information about even the smaller scholarships to apply for. Some of them just require a 1,000-word essay for, either $500 or $1,000. And I feel like anything is worth applying for.
Awesome.
Well, and I will step up and say, I admire my colleagues' proactive planning. Mine was a really happy accident, probably because it just seemed so confusing to me. I thought, I'm just going to get through school and see what happens. But it was actually my second job. And as I mentioned earlier, it was at an FQHC. So as part of my interview process, I did ask about the possibility of loan repayment programs, and then was helped and guided by my HR office in applying for the scholarship. I applied for 2 and was given 1. I applied to both the Nurse Corps loan repayment program, that's for folks after you've graduated, and applied to the National Health Service Corps program as well. So.
Awesome. And I will add to that I think it's interesting, and this is probably Christie's wheelhouse, if anybody, some of the tax is interesting between different loan repayment programs. So that's even hearing Elizabeth and Anand like talk a little bit about that. I was Nurse Corps after graduation, and so my tax rate looked different. And I think it's really interesting, Elizabeth, that you mentioned the HR department, because I've found at different FQHCs, they can be very rich and helpful. I've also found that sometimes they tend to be a little bit skittish, because sometimes they'll be like, oh, are you coming here for the loan repayment or to work? So I think it's key to even have those conversations early in, if you're interviewing, to say, I'm really committed to this population or this area, and I would love to take part in that. How do you help or work with that? I think that's really awesome to hear about your experience, that was a good thing though. Okay. And it sounds like the next kind of thought was, how was the program chosen? So does anybody have anything to add to that? It sounds like we kind of talked through National Health Service Corps and Nurse Corps. Anything from you, Michelle, on Indian Health Service side of choosing, or other options of folks you might have worked with in that environment as well? Or,
you know, for me, I wouldn't say I was tunnel vision. I just didn't have the knowledge to know what else was out there. And so by default, with my cousin providing me that information, I was like, okay, here's all my eggs in one basket. And luckily, as an applicant, I was selected and received the scholarship for my nursing education. And so, yeah, by default, but then over my nursing career, I have come to learn about some of these great opportunities that people may not know about. In addition, for any of the attendees, being Vanderbilt School of Nursing graduates, there's also opportunity for you to review some of these scholarships and be a reviewer, and that some of that is going on right now as we actively speak. They're reviewing scholarships for nursing or pre-nursing in some of the other disciplines as well. So there's also an opportunity for some of our alumni to get involved with that, being a reviewer for some of these scholarships or loan repayment programs.
that's awesome. That is super cool, I think. So I think it's interesting, and maybe there's several views of it depending on where you were in your journey and this became part of your story, but the experiences of being a recipient, I would love to hear if anybody has particular ones they want to share, or things that have kind of come out of the experience, or how you found commonality with others, anything like that.
Well, I'll just tell, this is what is called a life happens story. I literally had gone through the entire application process. I had received the $50,000 in my account. I deposited, paid off my student loan, and then learned, I think 2 weeks later, that I was being laid off. So, oh yeah, it happened. It was confusing. My collaborative was laid off, and they were convinced. Anyway, because my collaborative was laid off, I was laid off, which is good, because now I'm in my own private practice, and I don't think I'll ever again work for anyone else. Okay, you didn't hear me say that, except if they repaid my loans. I will say that HRSA has been really understanding. Apparently, lots and lots and lots of loan recipients or scholarship recipients were laid off during the pandemic. They've been very, very understanding. Here in my own private practice, we've had an outreach for nurses who are affected by COVID-19 who were suffering from acute stress disorder. We've come up with kind of a unique program. They are in the process of considering whether they'll allow my service here, specifically with that program, to count as service toward loan repayment. There's been no final answer yet. We're in conversations back and forth, but they've been easy to work with, very understanding, and I think quite helpful. So for the 3 weeks that I was officially in the program, I guess it was wonderful. I'd love to hear what y'all think and what your experiences were.
So I can speak a little bit to this. I actually ended up signing up to be a National Health Service Corps and Nursing Corps speaker regionally. So I went to a 30 clinic wide federally qualified health center that's kind of nationally known for combined mental health and primary care. And that itself lent to a rich environment of other clinicians that really cared about what the heart of the need was. And so that was one way I kind of networked with other people we did some different supportive things like Balance, which you may have heard of, Balance groups. So you can discuss difficult cases and emotions around those without breaking HIPAA. So there were some cool programs that came out of that. And I will say on a national level, LinkedIn and Facebook offer some really amazing connection groups too. Like I've connected with pharmacists who work out west at specific FQHCs, and then some fellow Vanderbilt alum who are also working with Nurse Corps or other things. So I think there are opportunities, and I think it can be very regional or even specific. I don't know if Michelle or Anand have any other things they want to share about those experiences.
I think my experiences have been good. I think there were definitely some things I learned along the way that were definitely, things to think about, like with the taxes being different with different scholarships. That was kind of a surprise for me in my experience. But also like going into it, I had the idea that I would have to work in like community psychiatry or like a small standalone clinic where it's like, or it's super rural. And I'm from outside New York City in New Jersey, and I'm very passionate about community mental health in like urban areas. And so I was kind of like worried about that. So I think some of the things that surprised me in a good way that I really do like is that I was able to work with the Nurse Corps people and be able to actually work in a hospital setting. And I ended up really loving working with kids in my clinicals last year. And that's something for which like standalone clinics, it's harder to come by. And secondly, I think when I finished my specialty year, I kind of felt like a little stressed in the sense of, I thought I would have to work somewhere where, it's an underserved community, understaffed, and I would have to take on a lot of responsibility without kind of respecting the fact that I'm still a new graduate and still learning in the process. But it ended up being that I was able to work in the hospital setting, and there it's an academic learning center too, and that made me a lot more comfortable, and it wasn't really what I expected to be working at. So overall, like I think there were some surprises, good and bad, along the way.
And this is Michelle, and for the Indian Health Service Scholarship, I had a lot of great support from the organization itself. Indian Health Service has 12 areas, and each area covers certain states. So when I applied, I was living in one of what's called the Oklahoma City area, which covers Kansas, Oklahoma, and Texas, at least. And so I applied, but I had a point of contact for the scholarship program application process. To this day, I will never forget her name. It's Judy Enyart. She was not only my nursing scholarship who helped guide me through the process, she also made the connection with the Indian Health Service headquarters for me. If there are any questions, she helped to facilitate any of those questions or concerns I had. And then she also helped transition me as I went from nursing school to work in Indian country. When you do utilize the Indian Health Service Scholarship, for each year that you're on the scholarship, you have at least 1 year payback service. And so there is a minimum requirement of a 2-year payback at a minimum. So for me, I had already had some college credits that transferred over to my nursing program. And so I was able to jump right into the nursing school part of it. And so I was on the scholarship for 2 years. And with that, I had a 2-year payback to do. And so she was right there from the scholarship to seeing me transition to a young nurse and until the day she retired. And so I will never forget the support she gave me. She too was a nurse herself and knew the program and was very supportive of everything. And then the program itself, even at a headquarters level, and Indian Health Service headquarters is in Rockville, Maryland, which you kind of scratch your head and wonder, well, that's nowhere near anything in Indian country, but it's a federal HHS agency, so that's where it's located. But for this girl from the Midwest, that was a big daunting thing to do. So she got me acclimated and was very supportive, as well as the organizational program from a headquarters level. They were all very accessible, very approachable, and worked with me to get me through the program from a financial support perspective, as well as other components, which we'll probably touch on here down the road.
That sounds amazing. It's great to hear of these experiences, and even that mentorship is just phenomenal. I think one of the key questions, and I totally would love to tag Christie in here too, about the application process and tips. So I think, a couple of things we've heard that we could always dive in further on are kind of really doing your research and not being afraid to jump in, but also other tips, like, are there financial documents you should have together? Any tips that anybody has from their experience would be awesome to share.
I can go with that. For HRSA, which is the human, I forget what it stands for, the federal agency, they put out, a very kind of like lengthy report, I think, on the primary care needs in the country, in the workforce. And that's something that I really printed out, sat down with, tried to figure out, what are the needs in this country with mental health, specifically for me, because that was going to be my specialty. And I really tried to find what stood out to me in terms of how will I meet the need for, the scholarship program and in my service afterwards. So I thought that was extremely helpful for me to plan my essays, to really focus on those things. And I think it's really important to be authentic in it too, because I think, sometimes you might, if you're really interested in just private practice, and not really working in community mental health settings with underserved people, then I think it's really important to really address that with yourself and not write those things in your essays, because you might not end up liking where you're going to end up. And so that kind of research was just very helpful. And I did as much to find out about what are the needs, what really do I see myself doing? Because I think some of the essay questions ask about that, where do you see yourself in a few years in this field? So it's a really good opportunity to because I feel people entering the pre-specialty program for the most part are, older to some degree, as in just not graduated college, just in the last year. And so that life experience really gives you that time to figure out, what do I want my contribution to be in this field? And so just using that as an opportunity for yourself too, with the essays. And there's a lot of them though, so plenty to write about.
Yes, a lot of the applications, I don't see them because they're, of course, outside of Vanderbilt. So not explained it well. So all the students can see the applications. There's really nothing that needs to be completed on the financial aid office side. So it's usually after you've been awarded, and then that's when I come into play with regards to the financial aid you've been offered and then getting the scholarship. So I know though it is very detailed. I have heard that with the HRSA scholarships.
Well, I prepared a short, because it was so detailed, Christie, and because I sort of went at the process backwards from my colleagues, I prepared a short slide presentation. Sarah, if you could put those slides up real quickly. And it's my understanding that we will share these with you all afterwards. So these are, again, these are all my opinions. I'm just going to walk you all real quickly through my own process. It sounds really complicated and kind of overwhelming and frightening, but it isn't. Start with the HR director at a site that you're looking at, that you've either been offered a job. Ideally, you will have been offered a job there, or you'll be in the process of interviewing with them, and you just ask them, so what percentage of those who've applied for scholarships receive them? And it's my, I was very delighted when I heard our HR director say 100%. That let me know right up front that it would be well worth my time and effort to go ahead and apply for the scholarships. One of the things HRSA looks at is it's what's called a HRSA score. And they basically score lots of different organizations, community, in my field, it's community mental health centers and federally qualified health centers. There's a place where you can go online, you can enter in places that you're thinking of working. Anecdotally, I've heard that, higher's better, and I think it goes all the way up. I just did a quick search. It looked like as if it went up to 23. Anything 16 or higher is considered pretty good. Christie, you may, or y'all may know differently. This is just what I'd heard anecdotally. Then I think this is real important. Just go online and sign up for an account. We can address the next page or move forward to the next page, Sarah. They're not currently taking, they're currently closed for any new applicants, but that's fine. Just put your email address down, and then as soon as they're open for funding, you'll get a notice. This next step is really important because there are so many questions we all have, and as several of us have mentioned, it feels overwhelming and kind of detailed. Attend an online webinar. I will let you all know it's a bit awkward because it's not like a Zoom call. It's like people type their questions and they type the answers, but the answers are very detailed and every single question will be answered. The other thing that surprised me is that after attending the webinar, I realized, gosh, I'm eligible for more than one program. I'm eligible for the Nurse Corps, I said scholarship program. Sorry, I should have said loan repayment program, as well as the National Health Service Corps program. I applied for both because it's identical information. There are no essays. You just have to have like your bank information, your loan information, the fact that you graduated. I mean, it was detailed, but it wasn't difficult. It took some time. Plugged it both in and then heard, I think within 9 months, that I'd received one of the two. I do recommend that you give yourself several days to complete the application, just because, trust me, there's going to be stuff that you forget, but you can save your application and come back to it later. Again, it's no big deal. I think maybe I spent a total of 3 hours on both applications. And then finally, we are in the midst of an opioid crisis in this country, and it's my understanding that if you apply for and receive your MAT training and your Data 2000 waiver, that, by the way, MAT training is medical assistance training so that you know how to prescribe buprenorphine, naltrexone, Vivitrol. The Data 2000 waiver is just a fancy way of saying normally they limit you to just 30 new patients, but because of the crisis, they're opening that up to, I think, either 100 or 200. I honestly can't remember. I did this, by the way, after receiving the loan, but were it me, and I was a new grad especially, I would absolutely get that training. And it's my understanding that in the PMHMP program, they're now requiring that of all new grads, which is excellent. Just makes you more competitive. You don't just have to be a site provider to do the MAT training. You could be any kind of primary care provider. And it's pretty straightforward. I've just done a little bit of substance abuse work. It's not difficult. I encourage you all to do it. And then finally, we can advance to the last slide, Sarah. If y'all have any questions, we are a community. We're here to help one another. Please feel free to reach out to me. This is my email. That's my text. Usually text is better. But I will get back to you. I say go for it and good luck. Thank you.
That was very helpful and a very realistic look, kind of having done it a few years ago now, but gosh, I remember the score days and the paperwork and some of that. And that was awesome. So that will be, I feel, highly used. So we have a few great questions, I think, from the chat. And I would like to go ahead and start with one that I think is really good that we don't always consider, or at least I don't. So this is somebody who's graduating from a primary care pediatrics or P&P, but they currently work as an RN at Vanderbilt Children's. How does this work? And so there may be more thoughts across like Vanderbilt, Emory, rural hospitals. So there's actually a great resource. And while we've been talking, I double checked something, and I have seen that Nurse Corps has had multiple people work at Monroe, at the Children's Hospital at Vanderbilt, and receive repayment. So I would say in the hospital system, I know a physician personally at Vanderbilt at the Med Center who also gets some repayment. I think all of his loans will be repaid over time. So there are resources in acute care settings. Never forget to check those out. I think, I'm a family NP and I've only been outpatient, and I forget about the importance of the acute care ability to get the repayment too, because I think we spend a lot of time talking about primary care. So that is, I would check out Nurse Corps for sure. I know specific states as well may have state-based repayment. So a colleague of mine, when I was at the FQHC Center, got the state repayment while I got Nurse Corps, and there can be some different restrictions on state, but it can also have tax favorability. So depending on where you're practicing, that may be very helpful as well. Okay, another great question here. It seems like there are many options in primary care, but do you know about acute care options that we should consider? And so you're right, Nurse Corps does include primary and acute, but again, I think we forget about some of the hospital classifications like rural access, emergent access. And so at the end of the presentation, I would love to share some documentation that we could give as well, because really my understanding is HRSA, which the Health Resources and Services Administration, like we were talking about in Rockville, Maryland, that is very familiar to me because that's where Nurse Corps is too. There's a lot there. And so I think HRSA is kind of like the parent, and then there are different branches. And so they're awesome. I mean, they may still know my name. I called a lot of times. So I will say some of the internet will be helpful, but they also have some really resourceful people. And I think acute care should definitely be well covered across the country, and then remote access too. Okay. Let's see. In addition to Nurse Corps loan repayment and National Health Service Corps, can you recommend other options to help get loans paid, or can you still apply for Nurse Corps or National Health Service this after graduation? Okay, and I see the beginning of the question too. So yeah, my understanding is you can. Does anybody else have, this person's been out of school for 5 years. Is it still, can you still apply for repayment? And my understanding is yes. Does anybody have any other thoughts on the call? That's okay.
I don't know for sure, but I promise you that's a question that you could ask in that webinar that I recommended everybody attend. I was newly graduated. I'd been out of school for 18 months. And it may have been addressed. I just don't happen to remember if there was a time limit on the length of time you could have been out of school. I think it's more tied to where are you working. If you are in an underserved area, that's far more important than the length of time that you've been out of school. But again, I would verify that by asking HRSA directly during a webinar.
And Elizabeth, just so I can clarify, with the webinar, you learned about that from being signed up on email, correct?
Yes, absolutely. So if you go to the site, I think Sarah, thank you, Sarah, for posting that. Let's see, it says sign up for an account by visiting.
Mm-hmm.
Just click on that link and it'll say we're closed to new applicants. Sign up. Do you sign up to be on our email list? Well, sign up. They'll notify you when they open again for funding. And then once you're signed up there, they'll send you emails saying, gee, we're having a webinar on such and such a date and such a time. And that's where you can really get lots of very, very detailed information and very helpful recommendations about how to proceed and what they're looking for. And what, you know, the year I applied for it, they were really, really looking for psychiatric providers and weighted us a little heavier. This year, it seems to be substance abuse providers. That's all of us on this call, or, you know, we can all get our MAT training. So the federal priorities change from year to year, and the folks at HRSA are very up to date and helpful in relaying that during the webinar.
Awesome. And they also, I've found social media, they're actually really active from HRSA. So that's what I was going to say. LinkedIn, sometimes they'll send, hey, are you interested? Do you meet this demographic? Are you this provider? And I think Facebook, they also have some groups. So I think the email is the way to go, but it's been nice reminders too, in case it gets lost. And let me get this next one. Okay, if you're an upcoming applying pre-specialty student, what would the recommended timeline be for applying for either the scholarship or loan repayment?
I believe the deadline for the scholarship has passed for the year that's about to start in August. I'm sure it's passed. Of course, if you're coming as a pre-specialty, you're going to be enrolled for 2 years. And I think somebody asked also, you know, can you apply for your second year? And you can apply. So again, I encourage students to go ahead and apply. Even if you applied, say, for the first year and you didn't get it, apply again. So yes, I would definitely encourage you to apply for your second year if you've missed, of course, the deadline for this year. And I think someone else mentioned or had a question too about loan forgiveness programs. And I'm going to put a link on the chat there that you can reference back to for those of you that have federal loans. And this is all available to view for anyone on studentaid.org.
Awesome.
And there is a possibility to have your entire student debt paid. While I applied for and received 2 years in exchange, well, $1,000, $25,000 a year, $50,000 total in exchange for 2 years of service, I had the option, and it was my intention. I really liked my job. I loved the population. I loved my patients. I felt like I was doing good work. I was planning to stay there for 5 or 6 years because you can always keep reapplying and reapplying, and they will typically renew your scholarship for as much loan. What am I trying to say? For as big as your loan might happen to be. Mine was $80,000, I think, when I started. So that, just don't forget that. If you find a place and it's your happy place and you want to stay there for a long time, that's awesome. It works out for everyone.
Yeah, I would agree. And I can second that. I had an option to renew in Nurse Corps and I chose not to at that time, but it's a great ability to do so. So this is a great question as well. Would you be able to speak on the difference between nurse scholarships versus loan repayment programs? And is the only difference when you apply for the programs? So I'm going to make a quick differentiation. There's like and Christie, this is definitely your area. There's like the scholarships at Vanderbilt and the scholarships you can apply for externally that are for nursing. And then I think for us, we're talking about Indian Health Service, National Health Service Corps, Nurse Corps, and state-based, and a few other like emergent access hospitals. So it's not always about when you apply, like before or after graduation, because for like HRSA and National Health Service Corps, you can apply before nursing school or after you're out. Same with Nurse Corps. So that's the major difference. And then Elizabeth talked about the score. So if you're a primary care provider, for example, the difference in the loan repayment programs may be, for example, I worked at a federally qualified health center that had a score of 18. And as Elizabeth was saying, 23 is the max. So the higher the score, typically the more sick the population, and the higher the score, the more likely you are to receive aid or repayment. So there's a lot of different factors, and that's where knowing if you're acute care, if you're psychiatry or psych mental health, maternal health, or F&P, that may be more specific. And applying, I would apply as many times as I could till I got something. I think that would have been very helpful in my personal story, but I think given kind of the years, like the physical year of what the government is planning, and your specialty can really reflect what actually happens as well. So I think, like Christie said, applying each year you're in school, you know, even if they give you pushback of pre-specialty may be helpful, but certainly as you get out of school, I started working, I graduated in August, got a job in November, and I was signed up for that listserv, you better believe it. So I knew that application cycle in February or March of that next year, I was in and I was going. And it can look different, obviously at different times, but that's where even almost keeping your tabs or a notebook of knowing what you're qualified for, and even networking with people who are in the programs can be helpful through LinkedIn or the Alumni Association.
And also, Hannah's correct in everything she's saying there about applying the differences. Another way to kind of help you remember the difference in the scholarships and loan repayment, scholarships are something you would receive while you're enrolled, and then a loan repayment is something you're applying for after you graduate, or after you graduate, you have the loans already. So scholarships are something you want while you're actually enrolled in school, because you won't be able to get a scholarship after you graduated. So that's one way to help you kind of remember the difference between the scholarships and the loan repayment programs.
Awesome. And
this is Michelle, and for anyone that knows any American Indian young adults who want to go into nursing school or even the health professions, they can go to the ihs.gov website and just Google scholarship, and it'll take them to the scholarship page with all the point of contact information, the application process. And for Indian Health Service, like Christie said, it's a scholarship. So they are going to school on a scholarship, and it doesn't matter if it's in-state tuition, out-of-state tuition, they will get their tuition all paid for. They will also get any kind of lab fees, books covered. You do have to get like a PO box, because that's where they will deliver any kind of communication to you. I didn't get this benefit when I was in school back in the early 90s, but a lot of the American Indian students do have to travel quite a distance, and I think our success rate could be better, but there's such a familial tendency for them to stay in their communities. And so for them to go to school is a very real concern for them, to be so far away from their support system. And one of the things the scholarship does offer is $300 a year for travel to and from school, so it's not so much of a hardship. They also cover, if your program in nursing school happens to be 2 years continuous, they will cover summer school for you. You do have to send in a form requesting the program, that your program does go through the summertime. And then the one big thing that is also very helpful is when I was there back in the early 90s on a scholarship, I got an $800 a month living stipend to pay for my living expenses being away. And that covered some of my dorm expenses, or when I went off campus to live off an apartment, it was $800 back in the early 90s. With inflation, it's currently $1,500 a month to help cover your living expenses. And then there's also, and I did utilize this service, which was a tutoring service, and they covered my tutoring expenses for one of my classes. I can't remember what it was, but now they offer $400, I believe, for the academic school year for a full-time student for tutoring services to help support the American Indian students to get through the nursing program. And then once they're done, they will go back and look for a job within the Indian Health Service or one of the tribal facilities. Now, with that being said, again, if you know of anyone that's interested in working in Indian country, you can go to the ihs.gov website. You can also find me on the faculty email address if you want to email me at my Vanderbilt email address. But then the other thing is that they do have what's called a pre-specialty program. So you're going your freshman, sophomore year of college, which you're not technically in nursing school. And there is a separate application for that. Then once you actually get accepted to nursing school, that is the nursing, Indian Health Service nursing scholarship that covers all those expenses that I had just talked about. And in preparation for this presentation, I had showed some of my colleagues before we got on. And after, Indian Health Service got a really good deal because I only had to do a 2-year payback, and it ended up being 23 plus years of my professional career. So I really enjoyed what I was doing. I loved it. Not only did I go from being a scholarship recipient, but then mid-career, I elevated to the level of an area nurse consultant, where I did work with nursing students to get through the program and get them recruited or answer their questions. So it's been very rewarding. And as I was preparing for this, oh, one other thing, I'm currently a nurse informaticist, right? So luckily today, the whole application process is online. You just go to again, ihs.gov, apply online. There's all kind of information. But I dug through, and believe it or not, I actually found my scholarship application from back in the 90s when it was all manual and you had to email or call them and ask for the information. So I found that. Then once I actually got that, they sent me my student manual, and here's that student manual. I'm not sure if you can see it, that they sent me. And then once I graduated, they had all of the IHS Scholar students come in for a conference to help prepare us for our transition. And here's the materials from that scholarship conference for that. So I'm not a pack rat, but I've worked for the federal government so long, I know to keep things and keep them in triplicate so that I can say I did my 2-year payback. So again, anyone that may be interested in the Indian Health Service Scholarship, just send them my way. And one other thing that you do have to be aware of is you do have to be a federally recognized tribe, and you do have to submit your paperwork that shows you're a member of a federally recognized tribe. Now, there are tribes out there that are state recognized. They may not be federally recognized, but they do accept the pre-specialty scholarship for state recognized tribes as well as federally recognized. But then once you get into the actual nursing program, it's just for the federally recognized tribal members. So thanks, Anna.
That's amazing that you saved that, by the way. That is so cool. Well, and I appreciate you highlighting like the vital information there. That is one part of some of the programs that I think are like underutilized sometimes. Like we're not sending enough people to programs that they really qualify for. So I love knowing that. And I also love knowing, that's one thing I will say, being the recipient on the back end, that there would have been some amazing, I think, gifts and even some fees paid had you been a scholarship student from the beginning. And I think that's one thing I would tell people applying now. And I think that's a huge part of the Indian Health Service program. That's amazing. So yeah, somebody in the chat just asked about maternity leave during the loan forgiveness. And I can answer this because I had a colleague who did experience this. So if you are a 2-year commitment, like different programs, I know that many of them do require, let's say you take an 8-week maternity leave or longer, whatever works for you, you do make up that time in those 24 months for the programs, at least Nurse Corps and National Health Service Corps. And that's one thing. Any kind of move around, I worked for a federally qualified health center that had high turnover, and I often ended up being the resource person sent to a center that either needed help or needed to be fixed from something. And every time you make a move, even if it's in the same federally qualified health center system, you have to let the association know. So HRSA expects to know, much like if you have time off for FMLA or any other personal reason, you know, vacation time and holidays don't go there, but extended leaves of absence, they have been traditionally requested to be made up, but they're very good about answering those questions. So hopefully that helped that one. And then I think the other ones, I think there were a couple that I think are about DNP and NP. So Christie, I know you you kind of answered the nurse faculty loan program, which is really, really a great program. And another one of our friends within nursing wanted to make sure we knew about the PhD loan repayment. So I'm going to share, this is from Dr. Alvin Jeffrey at Vanderbilt. For people who might be thinking about a career in research, the National Institutes of Health offers a loan repayment program that pays back all of your educational loans, whether undergraduate or graduate, over 2 to 4 years. It's very tempting. About half of the applications receive funding, so the success rate is high. This is only available to people who acquire a PhD and work for a nonprofit, like a university or other health-related nonprofit, and conduct research for a majority of their time. For those interested in a PhD but not sure if they want to incur more debt, it's worth noting that most PhD programs in reputable schools like Vanderbilt waive tuition for PhD students, so don't let the financial barrier be an obstacle to considering a research-focused PhD. If you have additional questions about a PhD and/or the NIH loan repayment program, one of the research-focused faculty at Vanderbilt, Dr. Jeffrey, can be contacted, and we can make sure that that information is provided. So I would love any closing remarks or final advice from the panel. This has been really great.
The process was not at all intimidating. There's just a lot of support. If you have to figure it all out up front, it seems overwhelming, but really it's pretty logical. Step 1, step 2, step 3. Y'all got into nursing school. You're going to graduate from nursing school. You can totally do what I've done. And I would encourage everyone who has a heart for service to sign up and to apply. It's well worth it. Even with my whoopsie that happened, I'm still glad I did it.
Awesome.
I think it's really important to just pay attention to the terms of whatever scholarship you're signing up for. I know I mentioned how like the National Health Service Corps Scholarship and the Nurse Corps Scholarship. When I received the Nurse Corps Scholarship, that was, I think, the first year that they started taxing the scholarship, and I also want to say I was emailing Christie all the time because there's so much paperwork she has to do for anyone receiving the scholarship. So like, thanks again for all that. And there's just a lot of paperwork with it too. And the terms of different scholarships, like with the taxing, like she was really great about helping us bear that burden. That was a little bit unexpected when applying to these scholarships, especially because you don't get to choose between the Nurse Corps, the National Health Service Corps if you apply to both. But I really was okay with the tax burden because Nurse Corps is a scholarship that had more places I could work that would be qualified. And also they gave you a longer period of time to find a job. Like they give us 9 months to like start working, which for anyone who wants to have a kid, then it's a perfect amount of time. And they also, what else do they do? I think they give you that time, and there's more places to choose from. You can apply for more, you can ask for more time and stuff. And overall, it's just been a pretty good experience where I think in National Health Service Corps, I think my impression was that you might have to go somewhere you really don't want to if you don't find a place yourself to work at. I could be wrong though. But I do think it's worth it.
Yeah, this is Michelle. And like Anand said, make sure, once you get the application manual, read through it. And at least for Indian Health Service, you do have to find a job within 90 days after graduating. They are very flexible and they do work with you depending on your circumstances. There may be some additional certification or training that you have to do between graduation and accepting that job, which may roll over that 90 days, may go farther than that 90 days. But as long as you're in good communication with your point of contact, with your scholarship or loan repayment, they're really good on working with you on that. So just make sure you read the conditions, because like I said, Indian Health Service, we have a need for healthcare providers, so much so that we can get you a job within 90 days. And then the second thing, don't want to scare anyone, but again, just read the fine print, because I do believe for the HRSA National Health Service Scholarship, as well as Indian Health Service, keep up to date with your paperwork, let them know where you're at. Do not go into default. Your default status, when you do have to, if you go into default, you do have to pay that money back to the government and the taxpayers at 3.5 times the rate of what they load you plus interest. So make sure you just stay on top of the paperwork, and they're very good on working with you with your individual circumstances if anything arises. That's it for me.
All very amazing perspectives and wisdom here, I think. And to kind of close, I will say that choosing to do the loan repayment that I was grateful to get was a great privilege. And I think that I'm very thankful. It helped my career immensely and helped me network. And I think each person that's on this panel has got such expertise, and I speak for all of us, that would say, please reach out how we can help. If you need a listening ear, if you need an application reviewed, if you just want to talk about Indian Health Service versus Nurse Corps versus state loan repayment, I think we are all here to help you. And I think our network at Vanderbilt is wide, and we can always try to connect you with someone who may be involved at a level perhaps that's new and we're not aware of. So it's a pleasure. Thank you to our amazing panelists. Thank you for your time and your expertise and your service to the school, to alumni, to current students. And I hope everyone has a great night. Thank you so much.
Thank you.
Bye-bye.